This video is about vascular malformations. To understand that, we need to understand the three main types of blood vessels. In our body, we have arteries, we have veins, and we have lymphatic blood vessels. All these blood vessels have a purpose. They are either taking blood to our organ or bringing back blood or lymphatics back to the heart. But what happens when your body creates blood vessels that don't have a purpose and look more like a tangle or a nest of abnormal things? Those are called vascular malformations. They are usually present when a person is born, but they can also present later in life when they start growing. Although technically they present as a growth, they are not like tumors, and they don't grow fast, and they don't spread. Sometimes they may not bother the person, and then nothing needs to be done. Obviously, if they are located in the brain or the spine, they can be very dangerous since they can bleed and cause significant disability. They can also be located within a muscle and cause significant pain when using that muscle, or they can be located somewhere in the GI tract and cause GI bleeding. There are several types of vascular malformations, including what's called an AVM, or arteriovenous malformation, where there is a connection between an artery directly to a vein, causing a very rapid flow. But there are also venous malformations, lymphatic malformations, capillary malformations, and some malformations are just mixed. But most importantly, we classify them in high-flow vascular malformations and low-flow vascular malformations. And this is very important because the treatment will depend on that. Usually, the high-flow vascular malformations are the AVMs, or arteriovenous malformations, or arteriovenous fistulas. And these high-flow vascular malformations are usually treated by angiography, by navigating a small catheter all the way to the artery feeding the malformation, and then injecting some type of glue or onyx, which is another type of glue, into the malformation so we can eradicate it. The tricky part is sometimes there are multiple vessels feeding it, and it could require multiple treatments, and they certainly can recur. It's not that simple, but treatments can be very effective. On the other hand, the low-flow vascular malformations, they have very low flow, so there's not really an artery feeding them. We treat the same way that we treat some varicose veins with a method called sclerotherapy. And that's when we go in with a needle, and sometimes we inject contrast to make sure we are getting the entire vascular malformation. And we do under X-ray guidance, and we inject a medication that will kill the vascular malformation from the inside. Of course, it's sometimes difficult to treat the entire vascular malformation because this can be big and they can have many vessels inside it and could require multiple treatments. If you have a vascular malformation and it's not bothering you and it's not in the brain or the spine, you probably don't need to do anything about it. You can just watch it. And if it starts bothering you, then we can think about treatment. But if they're bothering you, there are several minimally invasive options that can help. I hope this helps. This is Minimally Invasive Insights, and see you next time.